Assalamu alaikum wa rahmatullahi wa barakatuhu. Nahmaduhu wa nusalli ala rasulihil kareem. Amma ba'd. Fa'auzu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Because Ramzan is here, and when you move to the clinical side, you have double responsibility now. For your own self, as a Muslim, what you're supposed to do, then as a professional, because you are going to be heavily engaged in your duties and your studies and with patients. Now you are interacting more so with the patients. So you have another responsibility of transferring that knowledge and that awareness to your patients. And why this is important is not only because as a Muslim this is our responsibility, but also because many times patients would question you. Whatever disease they'll come up with, they would ask you, Doctor Saab, roza rakh sakte hain ki nahi? Doctor Saab, roza chhod sakte hain ki nahi? So unless you are well aware ke unko maine kya guideline deni hai, it will become very difficult for you. So remember this verse from Surah Al-Baqarah, verse number 183. Ya ayyuhallazina amanu kutiba alaykumus siyam kama kutiba alal lazina min qablikum la'allakum tattaqun. The address is to the believers. Fasting has been prescribed for you as it was prescribed for the people before you, la'allakum tattaqun, so that you acquire taqwa. Again, you are talking to patients day in, day out. You can always convey this message to them. Fasting is about taqwa. Somebody asks you that, Dr. Saab, can I fast? Can I skip my fast? And apparently you feel that it's not such a big deal because I'm already telling this patient to restrict his or her diet, and apparently the patient looks fine. So if you are trying to give an advice, okay, it's okay, you can fast. So while you say, haan, aap roza rakh sakte hain, you can give an added message to the patient. What? Yes, sure, you must fast. Don't you want to get closer to Allah subhanahu wa ta'ala? Don't you want to work on your connection with Allah subhanahu wa ta'ala? Because you understand what taqwa is. So rather than just saying कि तुम मुत्तकी नहीं बनना चाहते, you can say it's time for developing connection with Allah subhanahu wa ta'ala. And the stronger connection you have with Allah subhanahu wa ta'ala, the more you will be able to survive for the rest of 11 months. Then the connection of Ramadan with Quran. Again, you can advise your patients. If you look at this Surah Al-Baqarah, verse number 185, Shahru Ramadan allazi unzila fihi al-Quran. You can tell them that you should recite Quran more often during Ramadan, because many times what patients do is, because of their illness, whatever they're going through, they lose their spiritual connection. Sometimes start complaining to Allah subhanahu wa ta'ala, why this is happening in my life. Or because of their illness, they feel that it is not an obligation on them to pray or even read Quran. हमारी तो तबीयत इतनी ख़राब है कि कुरान पढ़ने को दिल नहीं चाह रहा. ये जो दिल नहीं चाह रहा वाला एलिमेंट है, you have to work on that area. You can advise the patients. For example, sometime when you are telling them, take this medication TDS. So rather than just saying TDS subah dopeher sham, what you can tell them is after Fajr Salah, then Zohar Salah, then Isha or Maghrib time. You highlight to your patients like that, even QID, even BD. All the medications or whatever you are prescribing to them, you can always guide them accordingly. Similarly, you can always tell them, आप जब कुरान पढ़ें अपने लिए दुआ मांगा करें. Everything is in Allah's control, and Allah can make anything happen. So we are setting our own targets, and at the same time, we are passing on these targets to our patients as well. Let's try to see how we facilitate our patients. What are the important concepts that we transfer to them? One important thing that we have to talk about to our patients during the month of Ramadan is about the food. What kind of food they can take during the month of Ramadan. Now, remember one important thing, that whenever you're trying to do something or whenever you're trying to tell other people, if you're not practicing it yourself, it is like a useless waste of words that you are spilling out from your mouth. आप जो भी बता रहे हैं वो सिर्फ एक भाषण है, एक टॉक है, and it is never going to be effective. Our deen tells us that when you convey to other people, at the same time you work on yourself. When you are also trying to streamline yourself, you will go through a lot of struggles. Desires, आपका भी दिल चाहेगा कुछ करने को, कुछ ना करने को, like your patients, like other people around you. Similarly, struggles. There are going to be situations, no matter how hard you try, you are not going to be able to find those things. You would be learning smart ways to refuse junk and other things if we broaden the spectrum on that. So once you practice yourself, number one thing, you are going to be more firm in what you say, more clear in what you convey. And it is also going to have impact on the people around you. You will lose your impact if you are not doing those things yourself. Many times what I've seen is when the doctors are advising to patients, they're not doing it themselves. Chai kam piye, khud 10 dafa chai pee rahe. Stop using oily stuff. Isn't oily stuff bad for all of us? Don't eat junk. What about us eating junk all the time? So we have to keep watch on our lifestyle as well. It is very important. Can you imagine for 5 years as a health professional, you study everything, you study the impact of everything on your body, you are conveying the message to others, and you're not practicing yourself. It's such a dilemma in our life. So what's the message, important message that you pass to your patients? And this is not just for Ramadan, for the rest of their life. What kind of carbohydrates they can take, which ones to avoid, how to add value to the content of carbohydrates that they consume. And you can Google and you can study and you can get books on nutrition as well. Once you go over these concepts, things become so easy for practicing and also conveying to others. You also need to give people message about simple sugars, white sugar, which is a poison. We need to cut out sugar from our life. And we need to move on to the natural sources of sugar. For this, you also need to set targets for yourself. Because in Ramadan, what we are doing is we are having sahri and iftar. Yes, we like to have our table full of food and everything, but still it is easier for us to set certain targets for ourselves and also convey it to others. Let's say if you have started cutting out sugar from your life and you have started looking at healthy alternatives like adding fruits, adding khajur, dates, adding honey, adding brown sugar. When you are going to be substituting it with the healthy options and your patients come to you, you can always guide them. So this is something which shouldn't be there too much on our platter when we are trying to have a healthy lifestyle. Similarly, what portion of protein we need to take, what kind of protein we need to take, balance in white meat and red meat, and how it should be consumed. That needs to be addressed as well. And then also the fats, what amount of fats one can take. If you have an educated patient, you can always tell them to Google themselves as well. You can check out from different sites and even give them link to certain authentic sites. This is in accordance with the principles which are there in Islam. How Rasulullah sallallahu alaihi wasallam used to focus on himself. And again, if you look at the latest sciences and nutrition, whatever people talk about, they give the same principles. Some practical tips for the health. You begin your iftar with date. This is a sunnah of the Prophet sallallahu alaihi wasallam, and at the same time we also realize this is an immediate source of energy. And at the same time, you need to tell people to rehydrate themselves with plenty of water. And by saying plenty of water doesn't mean you start gulping down water at that moment. Tell them to spread out the drinking of water like for next 3-4 hours. And again, a lot of sugar-laden or fizzy drinks or all those drinks needs to be avoided. So isotonic drinks or natural juice drinks needs to be used, which are good source of minerals, salts and vitamins. Then it shouldn't look like we are having a feast every day. Actually, I think our problem is that we watch too much of those commercials on the TV screen. So if they are showing oil or milk or any food item or anything which is facilitating food, You will see this lady in the kitchen who's looking glamorous, even in this heat. And then when she's laying out that food, everyone is so happy with her. Nobody's bothered about her character, how much skills she has. They just give her this loving look because she has laid out 100 dishes on the table. So this is sort of engraved even in our minds. That's exactly what we are expecting. We are out in our college or hospitals in the morning time. Then we go home, we are tired, we sleep. And when we get up and we are on our tables at iftar time, and if there are 3 dishes, we are like, kuch bhi nahi hai. What has been cooked? So remember, this is again the mindset of the people who are your patients. Because they are also glued to such channels, and this is exactly what they are learning. Resort to as minimum of fatty food as you can. The priority has to be what? Your ibadah. Salty food at iftar time and even at suhoor time, it's going to dehydrate you and it is going to increase your thirst. Many times when the patients will come to you and talk to you and they'll say that I do want to fast, and you apparently look at their disease condition and you feel yes, they can keep their fast, but they say I'm finding it hard to fast. Then you need to explore into those reasons rather than just saying कि ठीक है, अगर आपको मुश्किल लग रहा है तो ना रोज़ा रखें. What you need to tell them is कि what kind of food you take at suhoor time, what kind of food you take or consume at iftar time. That will give you such a clear indication, because the moment the patient would say, ज़ाहिर है डॉक्टर साहब सुबह पराठा खाएंगे और शाम को पकौड़े खाएंगे. And sometimes people say, नहीं मैं तो कुछ भी नहीं खाती, but since they are making for others or it is there on the table, दो तो खा ही जाते हैं. Then after Maghrib Salah, we need to have a very well balanced meal. What else we need to understand is the hydration principle. Cereals, salads, fruits and vegetables, they are excellent replacement for oily curries and fried snacks. Remember, your taste buds, they start changing in about 3 weeks time. If you continuously consume a food item or you stay away from a certain food item that you feel I shouldn't be taking, it's not healthy and I need to work on my health, then after 3 weeks, if you stop it for 3 weeks time, and after 3 weeks, if you consume it, you wouldn't enjoy it as much as you used to enjoy. Try in Ramadan, something which you know is junk, but you can't resist, cut it out for the whole Ramadan. Just tell yourself that this is part of my agenda. And similarly, you can give such targets to your patients as well. You have diabetics who say, I can't resist sugar. You have cardiac patients, and they say, or high cholesterol patients who would come up to you and say कि हमसे तो निहारी और पाए के बगैर रहा नहीं जाता, फिर हम खा लेते हैं. Sometimes you have their relatives who would tell you, डॉक्टर साहब ये परहेज नहीं करते. So again, you can give them a short target during the month of Ramadan. In moderation, we need to eat in moderation. What does our deen tell us? 1/3 for food, 1/3 for water and 1/3 for air. Now, by the time we realize that maybe it's 1/3, we are more than loaded. We are loaded till our esophagus. And that's when we say, bahut kha liya. Taking care of your oral hygiene is important, and physical activity in moderation should be done. This Ramzan should be a time for all the men to think about quitting smoking. I just don't understand the concept that in fasting, I have come across people who are fasting, and the moment they open their fast, they rush out because they have to have their quota of the cigarettes that they have. Cigarette smoking is haram in Islam. Anything which is harmful for your body, for your deen, for your property, for your family, all those parameters have been given. It is haram. Go to an oncologist and they would tell you how many people die because of cancer. Similarly, there are sometimes, if it's not affecting you badly, it is going to be affecting your family members. Initially they said passive smoking have some harmful effects. Now, then the time came with the research, they said passive smoking is equally bad. And we have reached a time when the claims are coming up that the passive smoking is worse than active smoking. Why? Because somebody who is doing active smoking is inhaling through the filter. But what is burning at the tip of the cigarette, that contains all the chemicals or components which are harmful for the people who are sitting around. So for your own health, if you have someone who is a smoker in your family, you can motivate them and you can help them set certain targets. Then there are people who skip sahur. If you're up the whole night, because sometime when you come back from your Taraweeh and then you understand that you have some days off and you can catch up on your sleep till Zuhr time because it's very hot and you want to be fresh by that time, and for Taraweeh, fine. If your target is ibadah, that you can do it. But just staying up otherwise, just eating like around 12:30 and then saying, I'm not getting up for suhoor, maine abhi se niyat kar li hai. Rasulullah Sallallahu Alaihi Wasallam has told us that we should be up for suhoor. We should be eating something at that time. Obviously something healthy. You don't have to fill up your stomach again